Hi guys, today's topic about allergic rhinitis. So this allergic rhinitis is an IgE-mediated inflammatory response of the nasal mucosa to the allergen. So this allergic rhinitis is an IgE-mediated inflammatory response of the nasal mucosa to the allergens. So this allergic rhinitis is two types. One is intermittent, second is persistent. What is intermittent? If it is less than 4 days in a week, or it is less than 4 weeks, this is called intermittent allergic rhinitis. What is persistent? If it is more than 4 days in a week and more than 4 weeks, it is called persistent. This intermittent or persistent initially called this is called as seasonal rhinitis in previous classification, and this is called perennial rhinitis. So this again intermittent and persistent according to the severity divided into again clinical ground. It divided into again mild and moderate severe category. See, this mild having normal activity. This moderate to severe affecting normal activity, disturb sleep, disturb schooling or work, disturb, and there is trouble some symptoms. So this mild doesn't affect your normal activity, but this moderate to severe affecting your normal activity, sleep disturbance, you're affecting your schooling and working, and it's lead to troublesome symptoms. Now this allergy. How this allergy double. This is the antigen. This antigen attached to this antigen presenting cells. What is antigen presenting cells? These are dendritic cells, monocytes, macrophages, Langerhans cells, and B lymphocytes. What are the antigen presenting cells? These are the dendritic cells, monocytes, macrophages, Langerhans cells, and the B lymphocytes. Out of these most severe activation of allergy lead by the dendritic cells. So this is the most common cell presenting with allergic rhinitis. This is dendritic cells which lead to severe activation of the allergic components. Now after this activation of attachment of this antigen presenting cells with antigen, this lead to activation of T2 helper cells or T cell activation. T cell activation. This T cell activation lead to different type of interleukin activation, like interleukin 3, interleukin 4, interleukin 5, interleukin 9 and 13. This leading activation to basophils, B cells, eosinophils, and mast cell. So activation of interleukin leading to basophil activation, B cell activation, eosinophil activation, and mast cell activation. These all cell activation leading to release of histamines, interleukins, cytokines, tumor necrosis factor alpha, interferon gamma. So these all cell activation leading to this inflammatory cytokines, which lead to the sneezing, rhinorrhea, and itching. So these are the classical allergic symptom of allergic rhinitis. Sneezing, these are mostly paroxysmal sneezing are there or repetitive sneezing are there. Rhinorrhea, or it is called watering of the nose, and itching. These symptoms may occur in the eye like conjunctivitis, redness, and eye itching or watery discharge from the eye. And these same can occur on the skin also, like dermatitis, leading to redness or itching on the skin. Now, what is allergic march? This is related to the allergic condition related to IgE activation. Allergic march is allergy leading to in or this is atopic march. What is this? If this allergen between 0 to 3 years of age develop into first allergy is the atopic dermatitis. First patient develop or child develop atopic dermatitis, then followed by food allergy, then develop into allergic rhinitis, ultimately develop to asthma or asthma. So this atopic dermatitis, food allergy, allergic rhinitis, and asthma are the sequence of the atopic march. So this is called atopic march. Now, what are the common allergens? Common allergens. What are these common allergens? Most common is the house dust mite. It is also called, scientific name is dermatophagotes. So this is dermatophagotes, also called carpet dust mite. This is the most common allergen. This carpet dust mite is like thick. It is just like thick, about 300 to 400 micrometer in size. And this tick or dust mite feeds on deepithelialized cells of the humans. So this feed on the bed, on carpet, this feed on the deepithelialized cell of the humans. Another most common is pollen. Third one is molds. Fourth one is grass and animal dander. These are the common allergens leading to this allergic reaction. These are antigens. Now, what is super antigen? This is very important. Super antigens. These super antigens are more dangerous to develop allergy than the antigens. What are the super antigens? These are the microbial proteins. So these are the part of the protein of the bacteria. It may be toxins of the bacteria like enterotoxin or exotoxins of the bacteria. It may be protein particle, DNA, RNA particle of the microbial protein. These are highly specific or leading to non-specific T2 cell activation without without antigen presenting cells. They doesn't need any antigen presenting cell to cascade the reaction of allergy. They directly lead to this allergic reaction without activation of antigen presenting cells. They directly activate and they lead to massive activation of T cell, leading to massive symptom of the allergic rhinitis. So antigen and super antigen. So these super antigen mainly found in the milk product, preservatives, and dry fruits, old dry fruits. So these microbial agent common in milk product, preservative, and dry fruits. So it means for allergy, you should avoid all these. Then allergy will be controlled most rapidly and most accurately. So these super antigen antigens act as a simultaneously, and super antigens are most dangerous. Now, how will you differentiate between allergic or this intermittent or persistent allergic rhinitis? Intermittent and persistent, differentiation on clinical ground. One is according to the, it is always less than 4 weeks. It's more than 4 weeks. Another is clinical signs like chronic signs of allergy. What are the chronic signs? First is allergic salute. Most of the chronic allergic patient, persistent allergic patient doing this movement. This is called allergic salute. Second is allergic crease or transverse crease. There is blackening line of the lower dorsal nose because of this allergic movement. That is called allergic crease or transverse crease. Third one is Denny Morgan's lines. What is Denny Morgan lines? These are the folds below this infraorbital region. These folds are known as Denny Morgan lines. Fourth one is allergic shiners. This allergic signs or signers is just below the orbit. There is fold. This allergic signs are the actually blackening over these Denny Morgan lines means over the fold. So blackening of the infraorbital region is called allergic shiners. So these are the chronic sign of the persistent allergic rhinitis. So how will you diagnose this allergic rhinitis? Diagnosis. Most important diagnosis is clinical diagnosis. If patient present with itching, rhinorrhea and repetitive sneezing, it is a case of allergy. Supported by skin prick test, serum, specific IgE and nasal endoscopy. Clinically, skin prick test for specific allergens, it's also called gold standard test for allergy. Where this SPT is not possible, you can do serum specific Ig level, which is not affected by antihistaminic therapy. So best test is skin prick test. In some cases of dermatitis and severe skin allergy, you can't do this skin prick test. You can do serum specific Ig test. And nasal endoscopy. On nasal endoscopy, you can see boggy terminates, bluish boggy terminates are the sign of this allergic rhinitis. So these are the tests. Now, how to treat? Initially, nasal vocation test is lab test only. It's not doing routinely because it's very invasive test. Same is nasal biopsy. It's also very invasive test. But you can do nasal smear. Nasal smear. That's showing more than 10% of eosinophil per eye power. This is also supportive diagnosis for allergy. But nasal on nasal mucosa, if as biopsy done, mostly not but there will be more than 50% mast cells are there in the mucosa than the normal mucosa. It is suggestive of also allergy. So allergic rhinitis can be diagnosed by mainly clinically, nasal endoscopy, IgE specific antibody test, and this skin prick testing, that is gold standard. Treatment. Main treatment is avoidance. Avoidance of allergens. You can avoid super antigen containing food or antigen containing food. Okay. Supportive treatment with avoidance, you can have high diet, which is helpful in allergy are onion, berry, tomato. These are very helpful diet for the allergy cases. And citrus fruits are very supportive in allergy cases. Another food is fish and fish oil. This is also supportive treatment for the allergy. Second treatment is medical management. What are the medical management? You can give antihistaminics, according to severity. First generation to third or fourth generation antihistaminic can be given. Then you can give topical or systemic steroids, and you can give leukotriene inhibitor or mast cell stabilizers. So these are the part of the medical treatment. Mainly we are giving second generation antihistamine like levocetirizine and cetirizine or fexofenadine are can be given. Topical, mainly we are using topical steroid spray. These are very fluticasone or mometasone sprays commonly used. Leukotrienes inhibitors like montelukast and mast cell stabilizer can also be added, like cromolyn. This sodium cromolate can be given with this therapy. So these are the medical therapy. Another is for permanent cure. You can give immunotherapy. Immunotherapy. This develop immune tolerance to particular allergen. After doing SPT test, you can do allergen specific immunotherapy. So this immunotherapy will help to cure the some allergens like dust mite and pollens can be treated by this immunotherapy. This is two types: sublingual immunotherapy and subdermal or subcuticular immunotherapy. So this immunotherapy can develop the immunotolerance. And fourth treatment is surgical treatment. What is the surgical treatment of allergy? Surgical option is you can do posterior nasal neurectomy just behind the this maxillary ostium. You can elevate the mucosa of the over the this between the inferior terminate and middle terminate behind the maxillary sinus, and you will find 2 to 3 branches of this posterior nasal nerve, and you can cut cautery of these fibers. So this decrease the sneezing and rhinorrhea. Second, you can do medial neurectomy in severe cases of allergy, but this is not recommended because this lead to dryness of eye. So this is better option. Third one, you can do terminate reduction, mainly inferior terminate, and if concha bullosa is there, you can decrease this concha bullosa by doing concha bullectomy, or you can do terminoplasty. You can submucosally resect this, or you can lateralize this inferior terminate. And fourth, you can do septoplasty or face. If there is any pollen or DNS of the nose, you can do septoplasty and face according to nasal polyposis or DNS. So these are the surgical option. These are supportive option only. You have to give this antihistaminic or topical steroid. This added this on this therapy. So this allergic rhinitis is very important topic. You should know super antigens as well as antigens which are important for the management. So this is all about allergic rhinitis. Thank you so much.